Hello, this is Dr. Bashura. Let's talk about bleeding. Bleeding is almost guaranteed after any oral surgical procedure. The question is, what is normal and what is not normal bleeding, and when should you call our office? When you go home after surgery, you will have gauze in your mouth. The purpose of the gauze is to absorb any blood so you're not swallowing blood on your way home. You need to be changing the gauze once every 15 minutes and look for quantity and consistency of the bleeding. The proper way to use the gauze is to put it on top of the wound with some pressure. It is the pressure that stops the bleeding and not necessarily the gauze being in your mouth. The goal is to control the bleeding until it is a very light ooze. Now, it is very normal that you're gonna get bleeding over the next 48 hours. And sometimes you'll wake up with some blood on the pillow. That is very normal after surgery. And I'm showing you here the difference between a heavy bleeding, light bleeding, and medium bleeding. And this is after the gauze has been in the mouth for about 10 or 15 minutes. Now, sometimes a lot of patients get some re-bleeding when their local anesthesia wears off. Do not be alarmed. Put some gauze in there with some pressure and it will slow down. For severe bleeding, if you feel like the gauze is not controlling it, try using a moist tea bag. Run the tea bag under some water, put it on top of the wound. Make sure the tea bag is in direct contact with the wound with some pressure. The tannic acid in the tea bag should control the bleeding very quickly. If severe and heavy bleeding persists and you tried the gauze and the tea bag and it's still bleeding 35 or 45 minutes later, we do want you to call the office as soon as possible.